conservative media viewers, what's going on? It's me, John D. Villarreal, and I've got a special presentation for you. But first I have to give the disclaimers. As you know, I'm not a medical professional. I'm not making any kind of medical claims. There's no medical claims in here whatsoever. It's up to you to talk to your own medical professional, make your own decisions. In fact, we're not making any factual allegations whatsoever. This is all my own personal opinion and the opinion of Dr. Jeffrey Miller. And this is all for informational entertainment purposes only. Check the disclaimers, all of them. In addition, we are getting paid for this video. You need to know that, but all these opinions are my own, and this is what I truthfully believe. Now, that being said, let's start on this. I'm excited about this because, as you know, I'm a 4-time national champion powerlifter. You know that. I was national to world class in 3 strength and combat sports, and I met Dr. Miller several years ago. It was actually he was introduced to me by a friend of mine who's also an athlete to help me with my competitions. He went on to sponsor me and help me win my last competitions, my last national championships. And let me tell you something. It really is so critically important. I've seen the difference in myself. I wanted to bring this to you. He's got some new incredible methodologies and technologies that he's bringing together that you might find beneficial. I definitely am someone that has benefited from this, and I think because I was in a situation where I competed at an elite level for 21 years. And you know, you do a lot of sort of damage to your body in that time. I didn't want to be in a situation where I couldn't walk later, where I couldn't do the things I want to do. When I had a family, I couldn't have that kind of you know, fun with my kids and play around as when I was younger. So it was really important to me to say, okay, not only how do I look for someone that can help me compete and win those last national championships at a high level, but also what can I do to sort of repair and heal my body to give it the longevity and sort of try to reverse some of the damage that I've done before. Dr. Miller has helped me do that. I want to introduce you to him, and I want you to hear what he's got going on right here. Dr. Miller, thanks for having us.
Absolutely.
Pleased to meet you. So tell me about your practice and tell me about the Miller method.
Absolutely. Well, John, you know, as you were saying, we've done some work on you for a long time.
Yes.
And previously we're mainly doing functional neurology treatments, which is a combination of physical medicine and rehabilitation with brain-based treatments. And so what we're doing is trying to integrate the overall central nervous system state and the joint function. We've actually incorporated the newest technology in spinal disc decompression, functional neurology, as well as the newest deep tissue high-powered lasers, which are able to heal different types of tissue, break down scar tissue, actually cause nerves to heal. One of the most amazing technologies. Now, it's not for everyone. It's not something that works on all patients. It's something that's going to be a case-by-case basis.
Right.
And so most of the patients we see now are going to be disc injury patients, patients who have significant pain syndromes, and patients who have long-term neuropathies or long-term chronic pain syndromes, as well as really serious injuries. Car accidents that are fairly significant, long-term injuries, and significant sports injuries. So that's mainly what we focus on. If it's a day-to-day sprain strain, or if it's a muscle sprain or something like that, that's something we'd probably refer to a physical therapist. There's other types of conditions that aren't necessarily going to respond, and so that's one of the reasons why what we typically do is do a consultation with the patient, review their medical case history, and then we use some tests to determine whether or not they're going to be a viable candidate for what we do.
I think that's awesome. So let me ask you a couple questions. What we were doing before was more what I would call sort of, and you correct me if I'm wrong, obviously you're the expert, traditional chiropractic.
Yes.
Okay, now, and then we're going to get onto the new stuff that you have here, which is extremely exciting. I've used a little bit of it, and we're going to show the viewers that later, which is awesome with the laser and the other stuff. But how does chiropractic fit into the sort of medical universe?
Well, I think today, properly done, and I mean this in every capacity, everybody, whether it be a physical therapist, a medical doctor, a surgeon, there are good and bad. And they have their own place in the medical spectrum. I think chiropractic has a very functional use in normal types of general treatment, right? It's good for getting joints moving properly, it's good for getting the nervous system to work properly when done correctly. There are certain specialists in the chiropractic arena. There are chiropractic sports physicians who do nothing but sports injuries. There's chiropractic orthopedists who deal with joint damage, you know, foot injuries, ankle injuries, hip injuries. There's different types. There's even chiropractic pediatrics, which is people who specialize in children. In my case, I have focused on functional neurology and the way that the nervous system interacts with the joints. And so that's what I do on a day-to-day basis, in conjunction with this specialized technique that I use, which I call the Miller method or the synergy method, which is functional medicine combined with the highest in deep tissue laser, functional neurology, nutrition, as well as lab work that we do, and the decompression, which I had shown you last time, and the laser, which we did on it, makes a huge difference, and it causes us to be able to treat certain cases that normally are unresponsive to other types of treatment.
So it's kind of like a synergistic method where you're bringing a lot of different methodologies together instead of doing one thing like, hey, this is just physical therapy or just chiropractic or X, Y, or Z, yes?
Absolutely.
Okay.
And that's why we call it, Synergy Laser Center. It's the incorporation of all of these. And as you know, in my other clinics, they were medical groups, so we had neurosurgeons and orthopedic surgeons and physiatrists and physical therapy and acupuncture. And now we've specialized in this type of condition, and in our office, we have the synergistic approach, the Miller method, which is combining all of these different types of treatments into one methodology.
And why did you arrive at this Miller method? When you looked at this class 4 laser and you looked at the spinal decompression, what do each of these things do, and why? And how does the combined effect really add that extra level of benefit for the patient?
Absolutely. I'm glad you asked that. John, as you know, different types of techniques are going to have different results for different people. So for me, when we looked at the functional neurology and the functional chiropractic treatments, we were able to make improvements on a lot of different types of cases, but there were certain limitations, and there were certain things that did not respond. We looked at long-term disc injuries where we'd have good results, but certain cases wouldn't respond. A lot of post-surgical cases wouldn't respond. A lot of chronic pain patients wouldn't respond necessarily favorably. And a lot of what we were seeing was long-term inflammation and this inflammatory cascade that continually would start up again. So patients would get deep tissue work, or they'd get chiropractic work, or they'd get physical therapy work, or they get injections, or they get different types of treatments, and it would restart that inflammatory cascade, and their problem would continue. What we found using the deep tissue laser is that it will reduce the inflammation in a lot of these patients, and we're able to see long-term results from a short-term treatment. So generally what we're going to be seeing is shorter terms of treatment with long-term results because of the tissue healing, if the patient responds. And again, it's a tailor-made program. We're going to be looking at incorporating the spinal decompression, because what that does is it reduces the pressure on the discs in certain patients, and it's able to reduce the amount of inflammation going on at the level of the disc and the facets, which overall will give us that long-term benefit. And then we combine that with the functional medicine, we combine that with functional rehabilitation, therapeutic exercise designed to stabilize those areas that are damaged. And that's what we do. And that's why we call it the synergy method.
I love it. And I want to know, let's break that down a little bit more detailed right now. Okay, so you've got this class 4 laser. What exactly does that do, and how is it different and more sort of powerful than like a class 3 or class 2 laser? It's something that other people, this is new technology.
Absolutely. The class 4 laser and lasers in general, therapeutic lasers in physical medicine, are going to be differentiated, and lasers in general are going to be differentiated by their power. So when you look at a class 1, 2, 3 laser, you're going to be looking at somewhere from 10 milliwatts all the way up to about 990 milliwatts. So less than a watt. Class 4 lasers start at about a watt and will go as high as 12 or even 15 watts. Now most of the time you're doing patient treatments at around 10 watts depending. It gives you more power, it gives you more ability to penetrate into tissue, and it gives you the ability to heal some of the internal structures that normally wouldn't be accessible through the class 3 or below lasers. Now a lot of the research is new, a lot of the things that we're doing with it are new, and so we can see these functional differences in our patients very quickly.
So in other words, like if I were to do a class 3 laser, how deep would that go into the human body versus a class 4 laser?
The penetration is going to be less with a class 3. You're looking at anywhere between half an inch up to an inch, depending on the type of technology. And then with a class 4 laser, we can see penetration down to 5, sometimes even 6 inches. But typically most of the research is going to give you around 4.5, 5 inches, something like that.
And with that kind of power and that kind of depth, that should be able to actually reach the actual spine and disc for most folks.
For most folks, and again, what we're looking at mainly is soft tissue, nerves, and scar tissue. That's most of what we're going to be doing with the laser, and then we use the other functional approaches with the disc to combine to get that overall result.
So this can help maybe clear out some of the old negative scar tissue in there, and then you were talking about how it helps heal with the fibroblasts and stuff like that?
Absolutely. It's going to increase fibroblast activity. It's going to increase the long-term tissue healing that you see in the structures. And actually, if you don't mind me talking about this, you've already obviously told me that, but that's what we're looking to do with your shoulder and some of the other joints, is get that scar tissue broken down without starting new inflammation using the massage or the traditional techniques. We're actually breaking down that scar tissue and getting it to start to heal. So that's what we're going to be looking at overall.
So tell me if I have this right. With a lot of folks, they have injuries, like athletes like myself, where they just kind of are like old friends. They're always with you, right? They don't seem to go away. And is it the case that a lot of times, or at least some of the time, that it's built up scar tissue that's trapping some nerve or creating some pain or not allowing that injury to re-heal? Is that the issue?
Absolutely.
Okay.
That's part of what we're looking at. You're having long-term scar tissue buildup, you're having long-term nerve damage, you're also having long-term joint issues, as well as neurological imbalances develop over time. Like in your case, we were looking at some of the imbalances when we did the testing on your muscles, right? We were looking overall at your central nervous system state and how your muscles and joints were functioning. We're using some eye movements, and we're using some arm strength tests to show us what the overall state was, and then after the treatment that improved. That's one of our monitors. And the biggest thing for us is really looking at monitoring our progress and making sure the patients that we accept are able to get results on an ongoing basis and that they're lasting results. And that's why we combine these therapies together.
That's great. And now with the new powerful Class 4 lasers, you're really able to get in there and clear out a lot of scar tissue and address injuries and therapies that you weren't able to address before.
Absolutely. Absolutely. And by combining the Class 4 deep tissue laser, which gives us these unprecedented abilities, with the absolute best in functional neurology, in nutrition, in spinal decompression, by using the best of all these areas, therapeutic exercise in addition, all of these tailor-made areas, we're able to get these long-term results that are unprecedented.